CEO of Midland Health. This is our daily coronavirus update for Thursday, March 26, 2020. We'll start with the numbers across Texas. As of yesterday late, we had 9 confirmed COVID-19 cases. There are 4 confirmed cases now in Midland County. In Texas, there have been 12 deaths from the virus and 1 death in Midland County. Here in our hospital, we have a census today of 136. Yesterday's emergency department volume was 9. As we've said every day this week, our volumes are unusually low as people continue to shelter in place and stay home. That's very low emergency department volume, so we're in good shape capacity-wise. We have ventilators, as we've stated every day. We have 7 in use today. We have a total of 44 regular ventilators plus 37 single-use ventilators available in the hospital, and so we have substantial ventilator capacity available. Also, more specifics on hospital census. In our critical care unit, we have a total of 13 patients today. In the separate cohort of persons under investigation, patients who appear to be suspicious for the coronavirus, there are 5 of those 13. Also, we have a segregated surge unit, and on that unit there are 8 patients, so a total of 13 patients under investigation among our inpatient census today. With regard to testing, so far the hospital or our affiliates have sent out 192 tests. We have 26 negative results back. Results, as I mentioned earlier, for Midland County. We're waiting on results for over 160 patients. We did hear from our primary laboratory vendor yesterday. We understand that the delay in test resulting has been the result of computer problems in their main lab. They had about 4 days worth of downtime and are having to do manual reporting for those 4 days worth of tests. That's obviously a very slow process. We're hoping that those results will come soon. For patients for whom there seems to be some more urgency, we have actually re-swabbed and sent the samples to another lab to get more rapid turnaround. So we continue to wait on those large volume of results from early last week. Let's see. One more, while we're talking about the one, this is a little bit of a technical issue, but it's an interesting one we talked about yesterday. We have some confusion around lab reporting. A typical virus panel has multiple viruses that are named coronavirus on it. There are actually 4 that are typically tested for, and as you've heard before, those are associated with the common cold. Those viruses testing negative and showing up on a typical viral panel does not mean that the patient does not have the COVID virus. The actual name of the virus that causes COVID-19 is SARS-CoV-2. That's the virus that we're looking for when we do the COVID test. So the regular coronavirus negatives don't mean that you don't have it, and that's a point we're clarifying with anyone who has access to lab results, and a new concern that we'll be communicating about in the days ahead. Okay, a few more things that are of interest, I believe. We've talked about our phone challenges. We have seen so much phone traffic, especially to our 6-8 nurse hotline, that we have worked on both technological solutions and the acquisition of additional capacity. And as of last night, we have additional capacity online, and we're about 1 week away from completing that entire project to dramatically and permanently increase our phone capacity, as well as to improve our ability to allow employees to work from home on our computer backbone. That project has taken some time, a lot of effort from our IT staff, and was funded substantially by the Scarborough Foundation, and we express our extreme appreciation to them for helping us to relieve that phone backlog. So that's we've almost got that under control. There's been a question each day about the drug combination. that you've heard about a good bit in the national news that may be having some positive impact on coronavirus patients. That combination is hydroxychloroquine plus azithromycin. Our clinical pharmacists have developed a protocol for use of that combination in the hospital for patients who are under investigation. Our infectious disease doctor has been involved in the development of that protocol, and we are actively using it now on the inpatients. We have some things happening with masks. One bit of encouragement is that our suppliers are beginning to come through with some of the masks that we've ordered, not the full quantity that we've ordered, but a substantial number. Our mask supply is holding as we don't have a huge number of patients in the house. We've had a tremendous response from the community in donating masks, all kinds of masks, including some N95 respirators. We have some folks who are sewing for us. People who have sewn for our volunteers for many years have changed their work and are sewing masks. We're using those throughout the facility. One change that has occurred just as of yesterday, we're beginning to put a mask on every patient who arrives at the emergency department, recognizing that when you come to the ED, you're coming to find out what's going on with you. You very well may have respiratory symptoms. You may either have or develop a cough while you're here. We're trying to be as cautious as we can be, both with the potential for exposure of the people around those patients who they encounter as they come into the facility, and especially the exposure potential for our employees. It's very important that we keep our employees healthy. And one of the easiest ways to protect from the droplet, the isolation, the droplets that can come out when a patient coughs, is to put a mask on that patient. So as of yesterday, we're beginning to put masks on every patient who arrives at the emergency department. Let's see, I talked about the virus. The last thing, the state asked us yesterday, and we began, along with hospitals around the state, to report our capacity and our census, to give good data to the state every day so that a comprehensive database of available service providers and capacities everywhere in the state is readily available to the state emergency management folks. We are complying with that order and reporting daily. I've told you that very soon we expect to be running a COVID-19 test on our own laboratory equipment. We'll have limited capacity to do that within a few days, and the state has also asked us to report the results of our in-house testing as soon as we begin doing it, to report those results every day, and we certainly intend to comply with that request. I believe that is all of my prepared remarks for today, and I'll be happy to take questions.
So by next week, you'll have a test?
We expect to have tests by next week. But one of the challenges we have is that, and they come when they come, so this is not any different from that. The assays that will have to come to run on our machine have to arrive before we can use them. We're told to expect them within a few days, but we really can't say they're here until they're here.
How many critical patients that are PUIs are currently on ventilators?
Let's see, we had 3 of those critical care patients on ventilators. As of yesterday, that's still true. 3 of the 5 who are in the critical care cohort are on ventilators.
You are ordering 45 testing and swabs.
It's the assay that actually runs on the lab equipment. We've got the swabs. The swabs are not the problem. We can take samples. What we can't do is actually run the test in the lab. What we've ordered is the assays that run on the machine we have in the lab that actually produce results. We've not done any of that locally to this point. All those swabs we've taken have been shipped off to multiple different labs outside of Midland, and we're dependent on them to turn around results today. When we have the assays available, we'll be able to do it on our own machines.
How exciting is that for you as the CEO?
Well, it's a pretty big deal. I think that the most important thing, as we've said every day, we've had anywhere from 10 to 15 patients in those persons under investigation cohorts that we're managing as if they are positive for the virus, but positive or not. I think if we could confirm that some number of those patients are negative, then we could move them to a different environment. We could treat them somewhat differently. We'd have room for patients who are positive. We'd have some peace of mind for the staff who are caring for them. The unknown is one of our greatest enemies now, both with the hospital patients who have symptoms and for the whole whom we don't know. Could certainly, we could have carriers walking around throughout the facility. That's why the social distancing, the stay-at-home policies are so important. We simply don't know the extent of the virus spread in the community. I'm not saying that our testing will cure that. We won't have enough volume to test broadly and really confirm how many people have it in the community. But as we have more people come to the hospital, as more people have symptoms, we'll be able to turn around their tests faster and know what we're dealing with.
We have several questions regarding to the numbers of testing. If you could repeat those total number tested, positive and negative.
I'll certainly do that. The question is about the test numbers, and I'll repeat those. Responsible for, recognizing that there are some tests being sent directly from local providers to various labs. These are the tests that the hospital has, the samples the hospital has taken in one of our settings. 192 of those total to date. 26 negative results have come back, 4 positive results in total, and so the balance of those, over 160 tests, are outstanding, waiting for results.
Can you give a status update on the patients that have tested positive so far?
Can we give a status update on the patients who have tested positive? Well, there are only 4 of those. The first of those unfortunately passed yesterday, and that patient was in the hospital for several days, and he died in the hospital. There are 3 other patients that we have confirmed are positive. None of those 3 are in the hospital. They're in the community, presumably self-isolating. We're not involved in their care, but we do know that much, that they're not in the hospital. Okay. I'm sorry. I think I said was incorrect in the day that our patient passed. Today is Thursday. He passed on Tuesday.
Currently, how many staff members are self-quarantining because of exposure and exhibiting symptoms?
The question is how many staff members are self-quarantining because they were exposed. I honestly don't know that number. It's small. We had a number of patients who were exposed to the original positive, or a number of employees who were exposed to the original positive patient. We have been tracking those through employee health. I know at least a couple of them have developed some symptoms and been asked to go home. The vast majority of them are still working, wearing masks, being monitored daily by employee health, watching for symptoms. If they develop symptoms, they will be sent home. That number was 2 or 3 the last time I heard it. It's not materially different from that. I think that's close at least.
Speaking of staff, there's a sign outside of the hospital now that says "Heroes Work Here."
Right.
Why do you think that is needed during a time like this?
Well, it's welcome. It was a gift from someone in our community, a great management and appreciation for the unusual circumstances that our employees are facing and the risks that they're taking every day and coming to work and doing their jobs. Keeping up people's morale and expressing our appreciation to them is a vital part of the effort. We don't know for how long we're going to have to ask our people to do this. We know that we have people whose skill sets are in short supply, and we need to keep them on the job and keep them motivated and keep expressing our appreciation to them for what they do. We know that we've asked people to do things that are outside their comfort zone, caring for patients who are in isolation, going from the work environment they're accustomed to, like in the operating room or the recovery room, where we've effectively shut down most of our operation, and asking those people to retrain and go do something else that they didn't choose to work here to do but are stepping up to do. All those things matter and will be vital to our effort to combat this disease over the next few days and weeks. And so everything that we can do to tell those people we appreciate them, we should do. That's happening across the community. The sign out front that says "Heroes Work Here" is absolutely true and very welcome. And I hope a lot of people see it and recognize what's really happening here. but throughout the community. We've had restaurants like Opal's Table deliver meals to our workforce. We've had people give us gift cards to restaurants and deliver food and other kinds of supplies that are needed. Lots of expressions of appreciation coming from all over our community. People want to help in any way they can, and we certainly want our employees and our physicians to feel appreciated for the hard work that they're doing and the risk that they're taking.
I know you've sent tests to a few different labs. Has one lab performed better than another?
Well, so far one lab has performed faster than another, and that's, we don't know if that's going to continue or not. One of the challenges that every one of these labs faces is they have an overwhelming number of tests, not just from us, but from all over the country. There remain a relatively small number of labs that can do this. As the new tests that have been approved reach the market, it's going to be much more widely dispersed, and it will be a lot easier to turn tests around. But here in the short run, labs that are not accustomed to these huge volumes coming from all over the country are having to adjust to that, and they're struggling.
I guess which lab is performing better?
I think we'll just keep that to ourselves at this point. We're trying to be good partners with all the people who are making their best effort to step up and help us, and I don't want to criticize one of them or praise one of them ahead of the others.
I guess at this point, and this can be an estimation because I know it's probably hard to have the exact date, but what's the oldest test that's been submitted that you haven't received a result on?
Let's see, what's the longest term outstanding of it? Do you know, Kit? It's at least a week, I can tell you that.
Yeah, I'd say somewhere in that ballpark, somewhere in the 18th, 19th.
Yeah, I think I know we have a number of tests that were sent out on the 19th that are not resulted yet. They're at least that old. There might be a day or two older than that.
Is there an expectation that y'all might use West Campus if things get bad, and how would that work? Would you send normal patients there and COVID-19 patients to the main campus?
The question is about the use of the campus as an alternative site, and is that a possibility? That I think there are a number of possibilities for alternative sites for patients should our volumes explode and exceed the capacity of the main hospital. The West Campus certainly is one of those, but you have to realize that has not operated as a full-service hospital since December 2012. So it's quite a few years ago. It did operate as a long-term acute care hospital with a limited range of services up until about 2 years ago. So the facility is in good shape. If we had to open up new beds, completely new, that hadn't been in use, it would be a good choice. But there is no infrastructure there. There's no lab, there's no pharmacy, there's no food service on that campus. So if we were to decide to use it for an overflow facility, it would take a good bit of effort to bring it live. There may be other possibilities that are better than that. I can tell you at the top of my list, and what I want to do more than anything else, is use the resources we have here right on this main campus. We have a low census now, only about half of our beds occupied. We have older facilities, especially those we've used for day surgery. That they're not fancy. They're certainly not new. They're not up to the standard of the Scarborough Tower, but they are. It is possible to bring them live, and if we did so, we could benefit from the infrastructure that's already in place here. So while the West Campus is a possibility, I wouldn't say it's likely, and we're continuing to explore sort of a prioritized list of where those expansion capacity locations would be. It'll be on the list, but I don't know if it'll be at the top.
For the 3 patients that are on ventilators, are we still waiting for their test results?
The question is, are the 3 patients on ventilators still waiting for test results? That's an easy one for me to answer, unfortunately, because we are waiting on test results for all persons under investigation in the hospital. We don't have any results for any of those, 13 patients today. Those results are outstanding on all 13.
Do you know the current range of ages of those to be observed?
The question is, do I know the range of ages of those who are persons under investigation?
Yes. As of right now, we do have one pediatric patient. We're not disclosing the age on that one, all the way up to the age of 81.
If you didn't hear that, a wide range from a pediatric patient, and pediatric by definition is under 18, and that's as much information as we'll disclose. And then our oldest patient is 81. Very wide range. That's all the questions from Facebook Live. Anybody else have one? Okay, I appreciate you all coming out today. We'll be back here tomorrow. I expect we will not do these on Saturday and Sunday, and then we'll resume on Monday. So we'll be here tomorrow morning at 9 a.m. Thank you.